Hi, everyone. Welcome to our webinar that has been hosted by the School of Public Health, as well as been sponsored by the Nelson Center for Entrepreneurship and the Center for Digital Health. The title of this webinar is called Diversity, Equity, and Inclusion around Public Health Innovation. And I'm very honored to welcome our panelists. I first want to introduce myself. My name is Jennifer Nazareno. I am a professor here at Brown University, and I have a dual appointment at the School of Public Health as well as the Nelson Center for Entrepreneurship. And today is a really exciting conversation where we're really trying to synergize and talk about how we intersect public health and entrepreneurship. And I do definitely would love to have this conversation, not just with the panelists, but with the attendees as well. So let me go ahead and introduce folks that are on the panel. We have Maheen Mausoof Adamson. Dr. Maheen Mausoof Adamson is a neuroscientist, director of rehab research at the VA Palo Alto, and clinical associate professor in neurosurgery at Stanford University School of Medicine. After completing undergrad degrees in biology and women's studies at UC Irvine, Dr. Adamson completed a PhD in neuroscience at the University of Southern California, followed by a postdoc fellowship in psychiatry and behavioral sciences at Stanford School of Medicine. Dr. Adamson is currently completing a Master's of Science in Healthcare Leadership here at Brown University. She has just completed the 2021 Innovation Fellowship, Healthcare Leadership at, the 2021 Innovation Fellowship, Stanford Center for Biodesign, whose mission is to identify healthcare needs and invent novel health technologies to address them. We also have Robbie Felton, who is a senior concentrating in public health from Ann Arbor, Michigan. He has been involved in activities at the Nelson Center for Entrepreneurship since his sophomore year when he founded IntisCare with 3 of his classmates. As a student entrepreneur, he has raised over $2 million in venture capital funding, landed major corporate partnerships, and successfully scaled a digital health platform to thousands of patients and providers. At Brown, he spent his time as the president of the class of 2021, coordinating board, a varsity football player, and an active member of Brown community on various university committees. We also have Jack Schaeffer and Eliza Sternlicht. Both are founders of MetaCircle. MetaCircle is revolutionizing healthcare equity by connecting unopened medications to patients in need. They collect leftover oncology pills from hospitals, employ a comprehensive 3-step proprietary quality assurance process to recertify the medications and redistribute the medications to financially burdened patients. These co-founders are now seniors at Brown University, studying applied mathematics and econ and biomedical engineering, respectively. Rory Stanton, an alum and founder of Ayla Health, or is it, Roy, am I saying that correct? Is it Ayla Health or Ayla Health? Yeah, okay. Roy's Ayla Health, a virtual first care and research platform for patients living with complex chronic inflammatory conditions. She received her MBA at UC Berkeley's Haas School of Business and her undergraduate degrees in human biology from Brown. Prior to graduate school, she was a digital director at Decision Resources Group, where she helped life sciences companies understand the complexity of autoimmune patient journey and build their digital patient engagement strategies. Rory leverages her deep expertise in digital health and interacting with patients, communities to lead Ayla's product and commercial teams. We also have Whitney Terrell, founder of Ream Company. She's currently a Brown graduate student pursuing a Master's of Science in Healthcare Leadership. Her professional interests lie at the intersection of health equity and social entrepreneurship. Her health-related experience focuses on innovation in health and human services, and she has worked on health systems and community partnerships, practice transformation, and disability fiscal policy. Whitney is a proud alum of Hampton University, a historically Black college, and University located in Virginia. Last but definitely not least, we have Elizabeth Wells, who's the former co-lead of We at Brown, which stands for Women's Entrepreneurship Conference that is hosted yearly at Brown University. And she has also been part of Brown Entrepreneurship Program, also known as EP. Elizabeth is part of the AB MPH program, working on interdisciplinary track and with mentorship from me, analyzing the intersection of entrepreneurship, public health, and tech. More specifically, healthcare AI, machine learning's role in the future of healthcare systems. She has also co-founded and worked with peers at startups in the nonprofit tech and sustainability. She has been part of the entrepreneurship program at the Nelson Center, serving as a co-lead of We at Brown team and conference. Welcome, everyone. What wonderful, I am surrounded by such wonderful co-panelists, and I'm really excited to get this conversation going. Okay, so again, as I've told the panelists, as well as I want to make sure the audience knows that this is meant to be a conversation. It's meant to just really talk about, each other's startups, but really their journey to getting to where they are now. And so the first question I really do want to pose, of all the paths you've taken, why entrepreneurship? Why now? And we often hear like, oh, disruption, and why the healthcare industry is ripe for disruption. What does that really mean? And lastly, just to add to this question, before we start, is Danny Warshay, which is a colleague of mine and is executive director of the Nelson Center for Entrepreneurship, often asks, as we think about when we start thinking about ventures or startups, is what is the problem you're attempting to solve? So I just wanted to hear some thoughts and wanted to get the conversation going. So please feel free to jump in now.
For me, it was really just being passionate about the problem. So we're working in the Medicare, Medicaid integrated space. So elderly and low income patients who are very socially vulnerable and have complex health conditions. And I think that home and community-based care is something that's very impactful for them from a social perspective and a clinical perspective. And that's where I want to spend my life working in this segment of healthcare. So venture was a great entry point into going really deep on this space and solving some important problems for providers and patients. So finding that passion is really the why entrepreneurship, and figuring out, okay, what's your mission in terms of your studies in public health, and then seeing, is there something that's a valuable and fulfilling problem to solve.
Robbie, so I'm going to push you too a little bit. So I am in the space of long-term care as well. Why long-term care? What is it about? What do we know about long-term care? And what are you trying to disrupt, or what are you trying to center around? How are you centering long-term care when it comes to entrepreneurship?
Right. So in public health, like I know Brown has a focus on geriatrics and gerontology, because it is a major issue thinking about the aging population. So how are we going to build infrastructure to care for the baby boomer generation as they all grow past the age of 65 and are declining in health, and then managing also the increasing longevity that we all have because of advancements in healthcare, better understanding our own well-being. So there's a lot that needs to be done so we don't expend all of our healthcare resources in this last 5 years of a patient's life or a person's life, and figuring out, okay, what are the most effective ways to allow people to age gracefully within their homes, which is the most ideal setting, while keeping them out of settings like the hospital or skilled nursing facilities that might be more expensive and less ideal for people. So that's really why we're working on it. We're looking at it from the data perspective. So how can we get ahead of acute events, get ahead of potentially preventable chronic disease onset? But it all really ties together with major trends like value-based care, shifting towards home and community-based models. And every one of those things are really looking to tackle this some of the major problems within aging.
Great. I'm going to hear from some other panelists.
I can go if that's okay.
Oh, Maheen, okay.
Yeah,
And
can you
Jack?
guys hear me clearly?
Yeah.
Okay. So I think it's a really interesting question because scientists and MD doctors are usually kind of in the background of the business world, right? They're doing their thing and they're discovering techniques and they're applying it to the patient. The business world is very different, right? And in the past 10 to 15 years, a lot of people in the clinical field and also in the research field have taken a jump to go into entrepreneurship. And I think the reason why is because number one reason, it's very exciting. None of us have to do it. And I was just at the alumni event at Stanford at the biodesign, and we were all standing together. And one of us actually said this: we all have regular jobs. And, we have jobs. We don't need to add this on. But it is challenging, it's exciting, and it's a space that allows us to discover, and it also allows us to transition what we know, our knowledge, to a larger audience and have a bigger impact. And when you do kind of work that we do, having an impact is one of the biggest things that affects our career. So that's number one. The number two thing also is that not just because of the pandemic, but seriously, a lot of the treatments that we use have, the placebo effect. And we are always looking for ways to do precision medicine. Well, the pandemic has made us realize this, and other things before have made us realize this, that there's a difference between equality and equity.
Mm-hmm.
And those factors actually affect the research that you do, whatever kind of research you're doing, whether it's, animal research, brain research, autoimmune disease, whatever it is, those social determinants of health, all those public health things that we just read about, they actually affect your research in a big way. And so for someone like me, having access to all this scientific knowledge, and now realizing that I have to reach over and grab all that I can from public health to do a better job of whatever I'm doing, to make it more precise, to make it more applicable, and to have a greater impact. So I don't think there's any other way but the entrepreneurship.
No, thank you for saying that. I do want to, Jack, I know you wanted to jump in as well.
Yeah, I kind of wanted to piggyback off of what Robbie mentioned about passion for the problem. For me, I kind of came at it from a different path. I studied applied math and economics and had minimal healthcare training before stepping into the role at MetaCircle. And when Eliza grabbed me and we started working together, I always knew I wanted to do something in entrepreneurship, but learning about the problems that exist currently in the healthcare industry, I learned that healthcare is the spot I want to be because of the social impact that you can have on people and the ability to really make change for a positive in people's lives. And I know, for Eliza and I, when we wake up kind of every day, it's a lot easier to wake up knowing that you're going to be doing something good for somebody rather than just being strictly in a profit motive, in a profit-driven environment. So I think for me, that's why coming from a different idea, I started with entrepreneurship, and I think healthcare is the best industry to step into.
Yeah, I'm also happy to piggyback off of that. So coming from someone who was taking a much more traditional path to medicine with the intention of wanting to impact patient lives, and then kind of stumbling and falling into entrepreneurship because I realized that this is a way, as Maheen was saying, to be able to impact such a large population of patients all at once and really to be able to affect that positive change. As a biomedical engineer, I work on several medical devices, and I'm also acutely aware that it's going to take a lot of time for these novel technologies to be integrated into insurance formularies and become accessible to a wide population of patients. So while that's really important, and I'm definitely going to stay involved in translational research, there's a lot of need for improving healthcare accessibility and affordability.
Oh, that's great. So as we're thinking through some of our ideas here, I also want to throw in this other question about, because I think what, what I'm trying to touch on as well is when we think about entrepreneurship, oftentimes a stereotype, it's very for-profit driven. It's very much focused on that part of just making, getting bought out, making, that stereotype. And I just wanted to hear more about what is your social mission around your company? Also, have you thought through diversity, equity, and inclusion as you've developed your startup? And what are some of the problems around diversity and equity, inclusion around entrepreneurship? And Eliza, I know we had talked about that a little earlier. Would you want to share some of your experiences?
Yeah, sure. So MetaCircle was created as a social impact venture.
Okay.
What we really are trying to do is connect patients with medications at an affordable cost. We've chosen the for-profit route out of a lot of meticulous deliberation just because that'll be able to expand how many patients we can access. And at the same time, we're very careful to ensure that our medication doesn't incur any financial burden on the patients that we're targeting. So at the forefront of our mission is still helping people. We just use the capitalist framework that we live in today to be able to achieve our missions. On the aspect of diversity, equity, and inclusion, we're trying to have a diverse cohort in every level of MetaCircle's infrastructure, from our board to our employees to our interns. I have a lot of experience just really facing some of the microaggressions that are associated with entrepreneurship, especially as a queer woman, and some of the intersectionality around that. Obviously, there's additional aspects of oppression that I don't experience, but what we found is that if you're not taking an active approach to DEI, you're not going to see any improvements. You can't just idly sit by and wait to build a diverse team. Every single one of our connections when we were first getting started was just like white male after white male, basically. And what we were seeing was that we were formulating a team of people that'll have very similar viewpoints and very similar backgrounds and experience. And that was just such a disconnect from the patient populations that we're targeting. So, we realized pretty early on that that was going to be a major problem for us. And, Jack and I, we sat down and we were like, we're seeing this as emerging as a problem. What steps can we do to increase it? And really being able to actively reach out for people who are going to come from different backgrounds, whether that's veterans, people with disabilities, people from the LGBTQIA plus community, people of different economic backgrounds, all of that. And just really seeing what strength can emerge from a team that has all of that diversity.
That's great. Definitely want to get Rory and Whitney and Elizabeth Wells to jump in.
Hi, I'll jump in on this. Yeah, this is something I'm super tuned into and passionate about. I've gotten into some arguments with some VCs, probably unpopularly, about the need for greater diversity and equity. I mean, I work in, what can be classified as women's health. So I work in kind of the autoimmune disease space. 75% of cases are female. It's kind of emerging in this femtech category. Although, broadly kind of impacts a large population across the United States and the world. And yeah, just, in terms of kind of thinking about how we build and design products that are servicing a specific group of people that have largely been ignored, felt invisible, unheard. I mean, that was actually why I designed the product the way I did, because women historically are undermined in the medical experience and not necessarily given access to treatment medication or get the proper diagnosis because some of their symptoms are dismissed. And so I wanted a way to help patients really visualize that for their providers. And that's kind of how ILO was born, through this deep pain point that many women experience dealing with long-term chronic symptoms. And so, yeah, when we think about kind of building the organization, this is something I'm very actively thinking about. Obviously, we have a great representation of women kind of within our leadership team, but also as we bring on medical advisors and kind of corporate advisors as well, And then thinking more broadly about kind of the intersection between kind of race and sexuality and a number of different, and disability, of course, obviously impacting our community and our patient population. How do we incorporate that in our hiring process? So we've actually partnered with a group called Chronically Capable, which services kind of the disabled, the need to have remote and flexible working environments, to be able to recruit them and bring them into certain positions within our team. And so really thinking kind of intentionally about that. And there are niche employment boards to kind of hire and recruit for those types of things. So yeah, that's how we're looking at it.
Rory, really quickly, how did you come up with Isla, the name? Because it's
Isla. Okay, so Isla means from the strong place, and I think kind of just to that story I was talking about previously is that, you know, with data, I think you can really empower a patient, and because the autoimmune patient journey is extremely fragmented, that data is everywhere. And so we wanted a way to kind of pull it all together and elucidate new insights about the patient experience. So that's kind of the impetus for the name and really the mission behind what we've been building here at Isla.
Wonderful. Whitney, Elizabeth, thoughts?
I think I'd be happy to chime in on my research that I'm focusing on. So I'm looking particularly at how healthcare AI, how to use public health as a critical lens to look at healthcare AI. And a lot of the research I've been looking at is kind of similar to what we're talking about with equity and inclusion. Just what data you're using to create an algorithm for a product is really important. So making sure that the data you're using is applying to your patient population. It's been found that a lot of minority and underserved populations are not properly represented in the algorithms that are created for healthcare AI. And also we see this in facial recognition. There was a big study done a couple of years back on how word embedding can impact the way that people are hired in the AI space, which can also directly impact healthcare AI as well. So I'm definitely looking a lot at how algorithms can impact the data we're using to create new products. And I think it's really important to consider as we look forward into this space, because if we're not serving the appropriate population, then in particular, with precision medicine, if we don't have the right data available, then how are you able to diagnose a patient with the right criteria? So there's a lot of the questions I've been asking as I've been looking at my research. And I feel it's really important as we look forward into the healthcare AI space.
Great. Whitney?
This question just opens up so much for me. I'm kind of thinking where to begin. And the entrepreneur, I think, can take a topic like inequity or diversity, equity, and inclusion in the healthcare or human services space. And it really starts oftentimes for me with the story of one person. And so if I were to share even a personal experience, about 3 weeks ago, I was hospitalized and a nurse, I was in a lot of pain, and a nurse basically sat me up from, I was comfortable at a 45-degree angle, and she sat me up to a 90-degree angle and told me to change into a hospital gown. And she insists, and I told her I couldn't because I was in so much pain. And then she walked out and she left the gown on top of me and said, well, we'll just wait until the doctor comes. And so my public health brain was trying to draw on see, this is how disparities happen. The lack of belief in the patient, the lack of empathy that leaves the room. She had read my profile, and I had been there the day before and not in as much pain, and she didn't believe me. And so when this happens, this is the compounding impact. And I felt afraid to be there by myself.
No, and so because this is a great segue into the company that you're starting. Tell us about Ream, because it's more inclusive. You're focusing on, I would say, a certain marginalized population. So can you share with the group your company?
Yeah, Ream is focused on insurance that really meets the needs of the Muslim American community, that really draws on Islamic finance and concepts that are very inclusive, that are intended to really share, ultimately, ideally share profits with people who are policy holders. And but it's really, to me, a backdrop, maybe not the core center of what I hope to share. But it helped me shift my emotion there quickly so I don't cry really on the call. But I think that those are the kind of stories, like if you find one and you're able to think about the complexities around that person, who, no matter if they're a public health professional and know all about social determinants of health, that they can show up into a hospital system or a healthcare system or some kind of community support that is supposed to be supporting them, that it is something that is sustainable long-term for whether they're on a public program or private insurance. It's something that's accessible to them. So entrepreneurs really have an opportunity to bridge the gap between a lot of the problems that we see in community and in healthcare systems. And as someone who's been a part of like healthcare reform initiatives that we're trying to innovate around those partnerships, the most successful ones have strong data. They are able to really bridge and have a great partnership with payers, whether they're like a public payer or a private payer. So I think that diversity, equity, and inclusion, though, comes into play from state employees, county employees. You would be surprised at how much work has to be done for the professionals to actually build programs that then are open to entrepreneurs coming in. That's one part. And then also that truly are designed to meet the needs of the public, all of the public. And I think, yeah, it's just, there's the internal part of organizations, and then there's actually the businesses who state governments or others partner with. And that culture part has to really happen across both, in addition to the design of the product. So I think it starts with either having your own story or sharing your story or finding that other story, listening for your relatives, listening for your community members who have a problem that you just can't leave. And if you're like, you look around and no one's solving it, it's yours. It's yours to figure out who's there. The thing about entrepreneurship is you might fail, it might not work out, and that's okay. But if you don't do it, you'll never know like what could have been possible for people who could be like helped by your product.
Yeah, no, great. Thanks. And Whitney, I'm sorry that that happened to you. And I just want to point out that you are someone that's an entrepreneur, you are very educated, but this still happens. This still happens to you in a hospital bed where you're treated differently or ignored, or and it's so sad that even in 2021 that a frontline healthcare worker could just be so dismissive. And so I really want to, how did you handle that? Or did you talk with someone about that when you were at the hospital?
Yeah, I feel, like that's something that's really transformative. It kind of fuels me when those things happen. I'm like, yes, this is why, like, I will go advocate. But what it does for patients of color or for anyone who experiences this kind of like discrimination in the healthcare system is like, now I have extra work to do. And so Rory was talking about the work of patients a little bit. And I love this book by Victor Montori that kind of gets at that. He's at Mayo. But what it does is like, oh man, like now I have to work my network, and now I have to go figure out how I talk to the CEO of that hospital so that they don't, next time they see a brown woman with a hijab or whatever kind of things were in their mind that day, they'll think about any patient, hopefully, and treat them the same. I think that hospital systems right now are very overworked. The night before that I was there, I just saw a lack of compassion. I was blown away by the lack of compassion in the emergency rooms right now. And I'm sure that's because so many providers are burned out. It all looks the same maybe at this point. But I think that, yeah, I'm grateful it happened. Hopefully I can make a difference because I do have relationships that I think could help maybe change the culture of that. But we can do something about it, at lots of different levels. So
Yeah. Well, thank you for sharing that. And I hear you, they are burnt out currently, especially right now. I do want to bring it to, well, I've been on panels and I've seen some of your decks. I've seen your pitches, and it's very polished, and I've seen, and it's wonderful. And can we talk about everything that goes on behind the scenes, that it's not always polished? There's a lot of it, quote unquote, as I don't know if we use the word failure, but like that there's a lot of grunt work, a lot of decisions that have to be made. There's a lot of maybe, just things that may have went wrong. And I also want to demystify, when we think about when you started as an entrepreneur, did you come up with this wonderful idea off the bat, or how did you come into entrepreneurship, and talk about just like the messy side of it, not the polished side of it, but just, I think we want our, audience to hear more about that, as well as those that will watch this recording later, but just to that vulnerable side of being an entrepreneur. And I'd love to hear some of your experiences.
Sure, I can start with this one.
Okay.
Yeah, the polished pitch at a competition or in front of an investor or in sort of webinar is 2% of the work. The other 98% is the hard part, getting there. So understanding the market that you're working in, understanding the problem, going through all the problems, building a product, building a team, building your story. So that last piece that you see, that's the polished pitch, is such a small percentage of what entrepreneurship actually takes. And it's an important part, but one of the least important parts of being a successful founder in solving a pain point for a population or for providers. And I think it's a little bit different in healthcare than in other spaces, because there's so much complexity that you have to wade through. To be successful in public health and healthcare, entrepreneurship and innovation, I'd say so much of the work is actually done on the research side. So it's great being here at Brown, a top research institution where you can speak to experts about what is actually happening in the space and what's coming next in the space. Learning more about policy, you have access to a huge network of providers, and you can really get a better understanding of everything you need to know to get to that polished pitch in front of an investor or in front of a group of people. And yeah, that's kind of the way I think about it, just diving deep into the research, and with a better understanding of the space, you can get to that point where you have a slide deck and have a clean presentation.
Robbie, Sean, I think Jack, you had your hand up.
Yeah, I'd love to jump in. I know when you asked that question, Eliza and I kind of grinned, because when we think about our story, we started with a very simple idea that we just noticed there was a lot of medication waste without any sort of, idea of MetaCircle, no concept of redistribution whatsoever. And I remember before even learning about that problem, there's a concept in entrepreneurship that I learned about called failing fast. The idea is you want to just put out ideas into the market and validate them quickly. And so Eliza and we spent one summer interviewing 300 people and just constantly developing our idea and further iterating on it. And today we've interviewed, I think, what is it, Eliza, now? Over 600 or so. And we just keep interviewing people. And what I've learned is the best calls are the ones where the people go, all right, I heard your pitch. Here are 20 reasons you're going to fail. And we used to send emails to people, and they'd send bulleted lists of reasons it's not going to work. And so now it's been we really rarely get a question where we go, okay, we've never been told that's going to be an issue. And so it's been really helpful for us, since we had such a, I guess, rough draft of an idea. We didn't even come to cancer before 5-6 months of looking at generics, hemophilia medication, diabetes medication. And so all of those iterations of our idea were really helpful in developing the final product. And so I think the key is getting out there and being not afraid to fail a lot.
Eliza, I see your hand.
Yeah, I definitely think the polished pitch is so far off from what the day-to-day life of being an entrepreneur entails. It's so messy, and it involves, staying up till midnight on multiple days in a row, like running solely on coffee and hearing relentless criticism. But if you're trying to disrupt a field like healthcare and you're hearing no pushback, you're not really disrupting it, are you? because this is like an institution that's been around for so long, and it has a very set way of doing things, and people shouldn't all like your idea. But that's where like the passion is so important, because the resilience of being an entrepreneur is how you're going to get to that polished pitch. Because there's so much that takes coming from identifying a problem to screening that need to being able to formulate a need statement and then a solution and all of that. It's just a very time-consuming process.
I have been carrying.
Go ahead,
I
Whitney, and
the
then
idea of the Reen company, it was not called that, just knowing that there was this problem in my life that I wish that I had a solution for a long time. And when I got to Brown, I was more focused on being a problem solver in my education. You know, so I chose this because I was working on a value-based payment project to design disability fiscal policy for Minnesota. And I was like, Brown would be a great place for me to work on that. But when I got here, and I also have a passion for social entrepreneurship, I was like, I knew I wanted to go into that space. I was starting to talk about it with my mentors and being like afraid, like what the people might think it's coming out of nowhere. But I thought to myself, well, I'm at Brown, why not? Like, this is a great place for me to do that. And then I found the Nelson Center and I was like, oh yeah, like I'm gonna try. All you're gonna do is tell me no if I don't. So to me, it's been an incredible journey to see like so far, just to see like my professional, sort of core professional interests supported, things I have to do right now, while also working on this venture that is really giving me, like feeding my personal passion that's kind of been behind the scenes for a long time. So yeah, I just wanted to encourage people, even if it's not in your area, you can still pursue your interests.
great. Rory?
I'm so impressed by this generation of entrepreneurs coming out of Brown and having that insight during your graduate education. So that's really cool. Yeah, I would say in terms of like the messy side, it's a total mess. But you know, I think being able to embrace that and just like, so, you know, there's a little bit of a divergence from kind of needing to know everything and have everything all laid out. I think entrepreneurs who are, you know, able to adapt and kind of take the new learnings as they come are generally more successful. And just being able to understand that there's things you don't know, and you don't always have to have a definitive answer about everything right at the beginning. I think you have your hypothesis about things, you test that hypothesis, you learn and you keep going. It really is a scientific method that you have to employ to continue to kind of go down that entrepreneurial pathway. But I think that was one of the big learnings for me, is that, you know, kind of wanting everything buttoned up as possible. It's just not possible when you're trying to build a big organization or do something truly disruptive. And so being comfortable in that unknown space, and know that over time you will figure it out, or you will connect with the right people that can help you sort things out, is really important part of the process. And yeah, the polished pitch is very much a cover, and you know, in terms of it being kind of like the top layer of things, but it's not necessarily what's going on the day-to-day where you're, you know, like Eliza said, chugging coffee and kind of working with your teammates and building something out of nowhere, because it truly is a really you know, difficult effort to get something off the ground, but it's not without its challenges and hiccups. And so you just need to be comfortable with that.
Great. Thanks for sharing that. I do want to, let's dive into, I think when we think about entrepreneurship, I want to talk, I'm looking at Maheen. You're a physician. Why would you have to venture into entrepreneurship? There's that, but also many of you are in public health, and most of your classmates or your peers, or even in other courses that you're in, are not entrepreneur and not thinking as an entrepreneur. And how does it feel to be like that person that, you know, that where everybody else is maybe just thinking more, I don't know if we want to call it a traditional path, but just not, you know, entrepreneur just sounds so foreign, or they don't quite understand. Like, what made you still think like, I'm going to do this, even despite all the negative emails when people tell me I can't do this, this isn't a good idea, blah, blah, all that you hear, what pushes you? Like, and I want to start with Maheen, because, you know, as you're a scientist, as a physician, what made you pivot to think more entrepreneurially?
So I think it's a great question, and I don't know if I can answer it fully, but I think a few things I wanted to say was that I think the way we actually do science and the way we discover and the way we challenge ourselves, so there's a good and bad to it. The good is it's a very important component of entrepreneurship already, because it gives you that motivation, that drive, and that feeling of, you know, the unknown and being persistent and patient. So I already have those things and I can go forward. Problem is, when you go into the entrepreneur world, you can't take your solution with you. So the first thing you have to know about the when you're creating your company or your idea is your need statement does not have a solution in it. It has the problem, it has the population you're addressing, and it has the outcome. And my gut reaction, and I'm sure a lot of people here who've done this, they walk into the room with the solution in hand. That solution has to be shed, because that's when you're doing all your design theories with those, you know, yellow or pink stickies and figuring out what the solution is. And so a good need statement is going to be the DNA of a great innovation, right? Now, all of us are doing a startup or doing something that is we're going to go for grants, we're going to go to the friends and family and the VCs. We're basically doing what lean management is. We're making do with what we have.
Yeah.
We don't have money to hire people. And that in itself is the hub, in my opinion, and also a lot of professors and universities, is the hub of innovation and creativity. That's why you gotta make things work. And that's exciting.
Yeah.
So as a researcher, as someone who was in academia, I've been doing part of this and finding funding for my projects and my hypotheses and my projects through NIH, VA, DOD. But I'm in Silicon Valley. Every other person I know is taking their ideas and creating bigger impact by going out in the field and asking for money from VCs and other places. And I'm looking at this for the past 5 years going, I'm sitting here and trying to get money from NIH and VA and DOD and all this. And the thing about those grants is that at the end of when you write those grants, you have a small paragraph that says, what's your future impact? And your future impact is always like, yes, I'm going to develop another grant, I'm going to put this in the hospital. But those practical trials, those things, they never really happen. Taking your innovation to the clinical side, the path, this is just my opinion, the path through NIH and the regular academic grant route is, I don't know if I can do it in my lifetime. It's maybe easier and something that we're all trained to do and be patient. But if I actually went through the entrepreneur route, I know it's challenging, I know it's harder, but it's easier to make that impact getting that scientific entrepreneur route. And right now is the best time because people are interested in science.
Yeah.
People are not, they weren't interested in science before. Now, because of the pandemic, they're all like, you know, oh, science. So people want to fund. And I think that's a very important point. And going back to something you said, Jennifer, Silicon Valley is looked at this is the negative part of it. A lot of people make companies so that they can make exits.
Yeah.
So so it's like a regular, I know a guy who's had 5 exits, you know, so it's like, this is a regular talk around here. Rory knows exactly what I'm talking about. So a lot of people have that sense but a lot of people also create a company and a product that they love and they want to stick to it and take it to the point that, you know, the environment is such right now that if you have a really good idea and if you're willing to even create a cartoon of it, there are people out there who will fund you without a minimal viable product. They will say, we like your idea, we'll fund you. That's the environment right now. It's up to you whether you're comfortable enough to allow someone to take hold of your entire product with a lot of percentage of the revenue and go forward, or you want to own the company, make your product and take it because it's your passion. So those are some of the things you have to kind of figure out. And I love doing that because it's something that that I just basically learned in the past couple of years, but I can marry it with what I already know about research and science.
Mm-hmm. I mean, Maheen, you bring up a really good point when you talked about why entrepreneurship. I mean, as a researcher, as a professor, I mean, I've worked with community organizations, and oftentimes the critique of academia is that it's just, what's the answer to you write this research paper, it's like, and then at the bottom it's like, I'll do more research on the same topic, and there's this frustration about, well, where's the change, where's the action, right? And I think and you're saying is that it can be, in your opinion, is through this entrepreneurship route,
exactly.
right?
Yeah.
Which I want to let's focus on that a bit more about this route towards entrepreneurship, because I want to also demystify. I think when we think about, when you hear about venture capital, all these terms, venture capital, exiting, Silicon Valley, I think there's this stereotype is that not only is it just a field of white men, but white rich men. And is that changing? Is that there? And we have to have an honest conversation about that, because when we're thinking about diversity, equity, inclusion, these are structures that we have to change, we have to push up against. But I do want to hear the on the ground experiences around that. So, Elizabeth, I want to hear some of your thoughts. I think there you
go. Well, I think like the reason why I'm really interested in like women's healthcare and like healthcare entrepreneurship in general, and just like women's entrepreneurship in general, is because like traditionally we haven't been funded in the VC space. I do think that is changing. Like we've seen funding is increasing for women, but I think it's still like we're still not where we need to be. And like, how can we convince like VC companies to fund women is like the biggest question I think that I'm kind of dealing with, because like eventually I do want to go and found my own company. Like that's my long-term goal in the healthcare space. But and I also wanted to touch back on the question you raised before. I was going to talk about how I feel that the reason why I want to be in the entrepreneurship public health space is because I don't feel that public health and in like a solely academic framework provides the necessary tools to address healthcare systems. So I don't think that, learning ways in class to like solve an intervention is the solution to like solving our healthcare system. I don't think it's the most effective way. And so that's a lot of the reason why I've kind of considered this interdisciplinary track, because I didn't feel like I really enjoy the School of Public Health. I feel very supported by my professors, but I didn't really feel like there was ways to consider like how innovation can support healthcare. So that's kind of why I've been taking classes in the Masters of Technology. I've been taking classes in the School of Public Health and Entrepreneurship, because I did some work this summer on how to consider FDA's approval of healthcare AI products. And we need to like consider how innovation can be supported by, the FDA or these regulatory pathways. So if we don't have an understanding of entrepreneurship, then we can't really support the transformation of these healthcare systems. So that was something I wanted to mention before as well.
Yeah.
Yeah.
You brought up a really good point. And I do want to say this. I do think, we shouldn't work in silos. I think when we think about diversity, we should also think diversity around our expertise, right? So yes, we're in public health, but we definitely want to work with the Nelson Center or work with the Center for Digital Health or other departments, other folks that have expertise that would just enrich the idea that you may have around solving some healthcare issues, right? So it's a really good point, is that we shouldn't work in silos, because one school does not have the all-encompassing answer to major healthcare problems happening in our country and even in our world. I do want to, I noticed that we only have 9 minutes left, which is really, this conversation has, I love this conversation. I wanted to keep going, but I want to make sure before we end, I did want to ask some of the questions that were asked by the audience beforehand that was sent to us. One was, can you provide some suggestions to students who are interested in public health initiatives and entrepreneurship? How did they get involved? So in other words, where was that entry point for you? Was it at the Nelson Center? Was it at the Center for Digital Health? Was it the School of Public Health? Was it somebody that mentored you? Like, how did you get involved? And how do you help a student, or what advice would you give to a student that maybe not intimidated, but just doesn't know where quite to start? And so if you could give some advice to somebody that's listening right now, and how you got into it, what was that first step for you?
I can start on that. When I graduated from Hampton, I went and worked in finance, and then I worked in green building. So I ended up having a health crisis, which made me, I was like, this is ridiculous. I was outraged. I was like, oh my God, this is horrible. So I called Daniel Dawes, who's like someone that I knew. He's like this renowned like health equity person who I happen to know. So I called him and I was like, hey, like, this is what I'm thinking. I'm like, I don't know if it's medicine. I don't know if it's public health, but I have got to do something about this. So at the time I did the smallest thing that I could really. And so I became a doula at that time. I didn't really like being a doula for like as a career, but I really enjoyed thinking about public health. So I came to do that. So that was kind of my entry point to healthcare issues, and kind of like basically networked my way into public health. But what I've enjoyed so much about like talking to him or other people is I started just to explore my interests in a small way that was easy for me to think about that topic. And then eventually when the healthcare reform work that I was doing ended, which is around the state innovation model at that time, I ended up working on disability fiscal policy. And, for me, I don't have someone I didn't know at that time in my immediate family who disability identity was not something that was a big deal. So I joined this leadership program, and I've done it in Minnesota, Vermont, and now Rhode Island, that really helped me connect with families and their stories that help make the work grounded in real systems. So there's developmental pediatricians, there's social workers, there's self-advocates. I really got to see like the whole system. And so now the way that I think about problem solving is like, I always want to know like, who are the people in the system? And that's why I chose Brown's master's program, actually, because I thought I would get a similar mix of people coming from a lot of different backgrounds, lots of different parts of the country, and obviously in an excellent institution. So I would say like, find someone who can help you start that journey of like the problem that you're interested in, and just keep asking to network, and maybe they'll be the board of directors for your company one day.
Yeah. Others?
Jennifer, I think you asked a really important question that I don't think gets asked a lot. And I congratulate you and give you kudos to asking that question, because it's a very thorny one. There's the gender issue, and then there's the race ethnicity issue, right? So there's women already are not very big in the entrepreneurship. So there's very few of them leading their own companies. Minority women with additional race and ethnicity on them, that's even lower. And it's quite surprising that there are certain fields that you will see each of them more, right? Depending, and that's in every field, like you will see a lot more women maybe doing less STEM work. So there's that STEM. So I'm breaking it down from women to race ethnicity to like STEM. So you'll see even lower in that. And I think one of the things we have to really, really be careful about and pay attention to is how much family support do they get?
Yeah.
People don't talk about that a lot. And I'm not saying, and that is a cultural aspect. Like, how much of the help do they get? How much family support do they get? Like we all said, it's an all-night job.
Mhm.
And it's you're drinking coffee and you're getting stuff done. And there's childbearing, there's child care, there's caregiving for older parents. And we already know that a lot of people out there who are caregivers are women. There was
Yeah.
a question in your email that you sent last night.
Mhm.
One of the attendees had a question about, I'm trying to create a startup for caregivers.
Mhm.
So I
Mhm.
wanted to address that. Caregivers also has this massive health disparity in terms of women, in terms of race, ethnicity, and education.
Mhm.
And I think you have to and that is another panel question that was addressed, is that you have to constantly educate the patient, the caregiver, and yourself, because all of you are part of a learning organization and you
Yeah.
learn from each other. And I think that that's something that there has to be a lot of openness. Everything has to be transparent. My husband's not letting me do this. My child is doing, there's a lot of, we have to be very open and we have to be very empathetic, have a lot of empathy for it. I just wanted to say that. Okay, I'll be
Yeah.
quiet.
No, I mean, the care infrastructure is broken, right? And it's gendered. So let me just say that. And it's gendered. And that's really, I mean, I know Robbie's working on long-term care issues, and we're starting to see ideas around thinking about how do we become innovative in that space. So I hear you, Maheen, because it's the time. You need time to think. You need time to fail. You need time to really think through with your team. And if you don't have that time, it's beyond VC capital. It's just having the time to think things through, right? To start your company. And I hear you on that. Okay. I did see, Eliza, did you want to say something? I saw your hand.
Yeah, really quickly. As you talked about, where do you start with entrepreneurship? The exciting and infuriating answer is that you can start at any of those resources.
Mhm.
Just kind of like how the open curriculum is at Brown, there
Yeah.
are infinite ways to get involved, and that can be great and that can be overwhelming, but ultimately it's going to be up to the individual to decide what they're focusing on and how they're going to follow through with that.
Yeah.
So there's great advisors. The ecosystem at Brown does an amazing job with offering that support, and you can really jump in anywhere. It's just, where do you find this need?
I mean, walk into the Nelson Center for Entrepreneurship, walk in, email someone from the Center for Digital Health, talk to any of faculty. I mean, we obviously, if I'm in the space of entrepreneurship, and I do think about the inequity and diversity around entrepreneurship, and I welcome your emails. I will walk you into the Nelson Center if I have to, just because if it is that intimidating, and I don't want it to be, because it doesn't have to be. And we're here to create a community of thoughtful leaders, of innovators, of those that want to, create social good through entrepreneurship. And this is a space that we hope that will grow, that we hope that people feel that they can be part of. I do want to see is anyone right now, the companies that, the CEOs and the founders right now on this call, are any of you looking for interns or people to join your company? And if so, please do let us know, particularly Sean Kelly. I want to call out Sean Kelly, who is on this call as well. He is Assistant Director over at School of Public Health for Career Advising. And he is the reason why we have created this webinar. It was his wonderful idea to bring us all together. And it's just, I think, Sean, if you could just, that last, I don't know, for just a second or two, talk about why you thought this would be a good webinar.
Great, thank you, Professor Nazareno, and thank you to everyone for joining as well. I really appreciate your insights. It's super helpful. For us, I think it's all about introducing students to many different career paths. And so we want to be as inclusive as possible and have as many diverse perspectives as possible. So it's been my charge to introduce all sectors, industries, and alumni perspectives and student perspectives. And so entrepreneurship is one of those that we often receive requests about. And so thank you for being part of this journey. I'm more than happy to connect students with you and vice versa, because I think there are many great things going on, and we want to keep this going.
Definitely. So I know it's time, but I wanted to say thank you, everyone, for this interactive panel, this panel that just, I do think really is, you know, just opening up people to thinking about entrepreneurship in a different way, and how it fits into public health, how we can, or how it's just, there is this intersection that I think we want to explore even more. So thank you for your time. I look forward to seeing you at other webinars and other events. All right, take care, everybody. Bye.